Hi guys, how are you doing? It's Elaine, Bintz, health coach, personal trainer, and we're on day 7 of our 30-day health challenge. It is Friday and the weekend is here. I hope everybody is having a great week and I hope your 2022 is going great so far. So today's topic is cholesterol. One reference you could use in your own life, if you have your most recent lipid panel. So what I'll do is if you've had a recent fasting lipid panel, you should be able to see your cholesterol results on your fasted lipid panel. If you have a most recent test results, we can reference them with these numbers. So before we get into what the numbers are, what is cholesterol? So cholesterol is this like waxy-like fatty substance that you have in your body, and actually your liver creates as much cholesterol as you need. You don't actually need to consume dietary cholesterol in order to have a good cholesterol. So some people, their liver creates too much cholesterol. So there is such a thing as having high cholesterol due to genetic factors because they've naturally had high cholesterol their whole life. So what is cholesterol? So yes, we need cholesterol. It makes these hormones like estrogen, testosterone, cortisol. It helps our body create vitamin D from sunlight. So cholesterol is necessary, but a lot of Americans have what's called high cholesterol. So what is normal? What is healthy? So if you have your numbers, so if you go back and you look at your lipid panel, 3 things I'm going to give you today are total cholesterol, HDL, and LDL. HDL is the healthy or the high density lipoprotein, and then LDL is that low density or the not so healthy lipoprotein. So let's first go over total cholesterol. So if you look at your results, there's probably a section that says cholesterol, and then it'll give you a value with a norm range of your total. So like mine is 133. That's what my total cholesterol was. So what is a good goal? 200 milligrams per deciliter. That's what the measurement is. You want to have a total cholesterol of 200 milligrams per deciliter or less. Another value that your total cholesterol or that your cholesterol, your lipid panel will give you are your HDL. So then we're now picking apart one component of it. One component of the cholesterol is the healthy or the high density lipoprotein. And my most recent result was 58 milligrams per deciliter. So that's pretty good. So what you want for your HDL is 41 milligrams per deciliter or more. This is actually one of those good cholesterols. You want more of this. So what I found in my practice working with endurance athletes, and then also working with people who do a lot of continuous cardiovascular activity, their HDL can be 50, 60, 90. I've had people come in with a total cholesterol number that scares them, but in fact, they've had a very good HDL number. So if you are talking to your doctor and you find that your total cholesterol is on the high end, make sure you look at the components. Don't just look at that total number. Also look at the HDL. And then if your doctor's talking about putting you on a medication like a statin, have a conversation about what your HDL number is. Mine is not super high. It's healthy. It's in a good range. It's 58 milligrams per deciliter, but it's not 80 or 90. And if my HDL number were higher, that would bring my total cholesterol number up as well. And then the third component of the cholesterol is what's called your LDL. So this is the not so healthy part of your cholesterol, which, it can increase your risk for stroke or heart attack. So if you do have a family history of heart conditions or strokes, you definitely want to keep a closer eye on this, and I'll talk about that in a minute. So your LDL level, so if you look further down, my most recent one was 66, and then the norm range. So I'm going to give you 2 norm ranges for the LDL. So the lab value where I went to get my labs gave a range of having 129 milligrams per deciliter of the LDL or less. But one thing you're going to want to keep in mind is if you have a family history of either high cholesterol or stroke, some of the things you're going to want to consider, or heart conditions, if you have a family history, and your LDL is above 100, sometimes the doctors, especially some cardiologists, depending on what your heart history is and your health history has been, sometimes you might be having a conversation with your doctor if your LDL is just above 100 and not quite 129. So again, Elaine Bintz, I am a holistic health coach. I definitely support whatever your physician says in regards to medication dosage and usage, and I'll support their diagnosis and their decision. But you also want to make sure you're your own health advocate, and keep in mind, depending on what your family history is, there might be another reason why your healthcare provider is suggesting that maybe you take a medication. Some lifestyle things, some holistic things you can do if you want to increase your HDL. Say your HDL is below 40 and you want to get that number up. Some healthy, natural ways to do that are to do continuous cardiovascular activity. So that could be like going outside, walking, riding a bike. If it's cold out, go use the elliptical at the gym. You could use the treadmill at the gym, use the bike. Also, diet plays a big role. So if you have a diet that's pretty high in like dietary fat, that can actually increase your cholesterol because of the way your body breaks down lipids. And fat is another term for lipids. That's what we use in the dietetic world. We call fat lipid. That's why it's called a lipid panel when you go and get your fats measured. So if you have a diet that's high, especially in saturated fat, which is fat that's like a solid at room temperature, like your coconut oil, if it's solid at room temperature, and then your trans fats, which a lot of trans fats are found in like your processed foods, crackers, cookies, things like that. But if you do have high cholesterol, you definitely want to take it seriously. This is one of those things you really do need to keep an eye out on. And if you have been diagnosed with high cholesterol and you've made dietary or lifestyle interventions, you could maybe down the road lower your dosage of the amount of medicine you're on if you've been prescribed a med. So again, my name is Elaine Bintz, health coach, personal trainer. Today's topic, day 7, it's Friday Fun Day, is cholesterol. I hope everybody has a great day, and I look forward to seeing you tomorrow. Have a great day. Bye.